Hi, good afternoon. My name is Terika Thomas Mills, and I'm going to be inserting and discontinuing a peripheral ID. I'm going to IV, a peripheral IV. I'm going to start by doing my hand hygiene. I'm going to apply my gloves. I'm going to gather and organize my supplies on a clean, clutter-free table. For this skill, I have my my catheter, I have my IV starter kit, I have my IV extension tubing, and I have my non-expired saline flush. I am gonna go ahead and I'm gonna prepare all my supplies, and then so I have already, for my techoderm, I have gone ahead, I have dated, I have initialed, and I have put the time and the size of the catheter that I'm going to be using. So I've gone ahead and done that, so I'm going to set that aside. And then I am going to go ahead and I am going to flush my extension tubing to ensure that there is no air in the tubing. I am going to go ahead and flush it with my saline. Okay, because we want to ensure that there's no air in the tubing, because we don't want to inject any air in the patient's arm. So now that this has been flushed, I'm going to set it aside. Okay, so for my patient is a 75-year-old male. He's here for rehydration therapy. I'm not anticipating any surgery or any blood products. So for this patient, I'm gonna be using a 22-inch gauge catheter. Due to practice and inability to do or to get this skill done properly, on a number of attempts, I have used up all the 22 gauge needles that I have. So I am going to be using a 20-inch gauge because this is what I have. But in the real world, for this patient, I would use a 22-inch gauge. Okay, so now I'm gonna go ahead and I'm gonna apply my tourniquet. And when you apply the tourniquet, you want to make sure that it's 4 to 6 inches above the anticipated IV site. And then you're going to ensure that it's not applied too tight, because you want to ensure that the patient still has a distal pulse. Okay, so I have applied my tourniquet, and now I am going to go ahead and I'm going to clean the site. What I'm going to be using is an alcohol pad. So since I'm going to be using an alcohol pad, I am going to be cleaning in a circular motion, and then I'm going to be cleaning from the inside, and then I'm going to be working my way outwards. Okay, I am going to ensure that the site is dry. I'm not going to fan or blow it. I'm going to let it air dry, and then I'm going to, after it's dry, then I'm going to anchor the vein down. Okay, so now I am gonna go ahead, I'm gonna pull the skin nice and tight, and then I'm gonna go ahead and I'm gonna insert my IV. I am gonna insert it. I'm gonna hold the skin tight. I'm gonna insert my needle at a 40-degree angle, making sure that the bevel is up. I'm gonna go ahead and insert, and then I'm gonna watch for any flashback in the chamber. When I notice that there's a flashback in the chamber, then I'm gonna lower to a 30-degree angle. I'm gonna lower my needle to a 30-degree angle, and then I'm gonna insert advance for another quarter of an inch or so. Now that I do that to ensure that the needle is inserted in the vein. Once I realize it's inserted in the vein, then I am gonna go ahead and I am gonna release my needle. I'm gonna use my non-dominant hand to stabilize the stabilize the catheter, and then I am gonna discard my needle in the sharps container. Okay, now that the needle is discarded, I am gonna go ahead, I'm gonna attach my tubing. All right, so I have attached my tubings. I'm gonna go ahead, I'm gonna aspirate for blood. And then after I aspirate for blood, I am gonna go ahead and flush my tubing. I'm gonna look for any signs of infiltration, any blood forming within the saline line. I'm gonna look for discoloration and any discomfort or pain. If I notice if there's any of those signs, it would mean that I probably need to reinsert the IV. But since we don't have any of those, then I could go ahead and I'm gonna remove the saline. I'm gonna discard the saline, and then I'm gonna cover this. Ideally, this would be a lock layer cap for the tubing. If we don't have that, then I'll use a sterile cap to ensure that the end remains sterile. Okay. Now I am gonna go ahead and I am gonna place my techoderm on the over the IV site. I'm gonna ensure that the IV site is visible, as well as the connection point of the extension tubing. I'm gonna make sure that they're visible. Okay, so let me okay, so I'm gonna remove the outer wrapper of the techoderm. And then I'm gonna use I'm gonna go ahead and clamp the IV. Okay, and then I'm gonna get a piece of tape and I'm gonna tape my extension tubing, but I have to ensure that it's not taped to the before I apply the techoderm, I should have held the IV with my non-dominant hand, and then use my hand to release the tourniquet. So I'm just backtracking. I'm going to release the tourniquet. Okay, so after I release the tourniquet, that's when I would go ahead, apply the Tecoderm, and then I would tape the end of the tubing. After I do that, then I am gonna put my label on my dressing, so it is you could see what date it was done, who did it, the time, and the size of the gauge that I use. So now I am going to okay, and so now that I've done that, I will remove all my supplies. I'm gonna discard those in the trash, and then whatever any sharps that I have would go in the sharps container. I am gonna remove my gloves. I am gonna perform my hand hygiene, and then I'll go document my procedure. Okay, so now that the IV has been inserted, I am gonna have to discontinue the IV, but before I could discontinue the IV, I have to ensure that the order is in for the IV to be disconnected. So now I'm gonna go ahead again. I'm gonna perform my hand hygiene, and then I'm gonna apply my clean gloves. All right, so I am gonna start by removing the Tecoderm. All right, so I'm gonna remove the Tecoderm, but in order to remove the Tecoderm, I have to make sure that I hold on to the catheter so that it's stabilized, and I'm gonna go ahead. Okay, I'm gonna discard that in the trash. And next I am gonna go ahead and I'm gonna remove the tape from the tubing. Okay, all of those I'm gonna discard in the trash. Next, I am gonna have to slowly and gently remove the IV, but before I move it, I'm gonna take a piece of sterile gauze and I'm gonna hold it. I'm gonna remove the IV nice and slow. Okay, now that I've removed it, I am gonna inspect the integrity of it. I'm gonna make sure that it's the right length and size that was on the label, and then after I've done that, I am gonna discard in the sharps container. I am gonna keep pressure on the side for at least 30 seconds until the bleeding has been controlled. After the bleeding, 30 seconds have passed and the bleeding has been controlled, I am gonna take a clean piece of gauze. I'm gonna cover it, and then I am gonna tape my gauze down. Okay, so I have gone ahead and I have taped my gauze down. So now that the gauze is in place and everything and it's taped down, I am gonna remove my gloves. I'm gonna discard my supplies. Whatever sharps I have goes in the sharp container. I'm gonna remove my gloves. I'm gonna discard those. I'm gonna perform my hand hygiene and then go document my procedure.